Senator Minister. Yeah, that's great. Okay, thank you, Senator Carrigy, and just to commend you from the chair and the fantastic work you do in this area, and particularly your work as chair of the Autism Committee. It's made a fundamental difference in this House, so well done. Our next commencement is Senator Clone. Senator Clone.
Minister Urganuso, thank you very much for coming here today. I was informed last night that it was you that would be here, and I was actually very pleased to see that. Not only because you're my local representative, of course, but also I know you to be a person of absolute intellectual and ethical integrity. So the matter I'm going to raise here, I know that you'll get the import of it. Now, we may be distracted by, let's say, matters in RTE, or let's say the cost overruns in the Children's Hospital, but really, compared or in the context of the concerns that I'm raising here, they're irrelevant, because we're talking about here young lives. So I have raised here before the issue of children over 200 on waiting lists for spinal surgery in Temple Street and Crumlin Hospital, on the watch of Children's Hospital Ireland, on their senior executive team and their CEO. Those children are being failed, but it has also been brought to my attention that children on the urological waitlist are also being failed. And when you fail children, young adults and adolescents, when you fail them consistently over time without a meaningful intervention, in my mind it becomes a form of almost like institutional abuse. So on the urological surgical waitlist, I just want to be specific. The model of care that's recommended in the international medical community for children and young adolescents in particular on the urological waitlist is called the transitional model of care. It's been in place in the National Health Service in the UK since 2002 for over 20 years, and in the United States since about 2005. We don't have a transitional urology program on the watch of CHI. So children who need surgical interventions approximately every 18 months as they develop from children into young adults, into young men and women, those interventions are not taking place in Ireland. And what should be an 18-month therapeutic window, the average wait list for a child in Ireland to be seen by a urologist, and these are disabled children, a lot of them would have cerebral palsy, spina bifida, other conditions. The wait list for your first consult is an average 2.5 years, and then a further 2.5 years to get surgery. That's 5 years. And what's happening during those 5 years? Well, I'm sorry to say, for girls, many need vaginal reconstruction. That's not happening. And that has a knock-on effect then for their psychosexual development, their sexual development, and their fertility. In boys, you can have erectile dysfunction, you can have penises that are permanently bent because for want of a little surgical intervention on the way, and that leads to erectile dysfunction, ejaculatory dysfunction. These lead to the increase of risk for cancer. In the case of colorectal cancer, if you don't have these interventions, you have a 100-fold greater chance of contracting colorectal cancer. And for bladder, it's a 600-fold increase in the risk. These interventions are not happening. We have young men and women, Irish disabled children, teenagers, who suffer from infertility, incontinence. It affects their kidney function. They suffer with UTIs. Many of them are wet. They're wearing incontinence pads. And these are children who are trying to go through their little development milestones, and their urological goals are not being met. I have no confidence in the executive management team of CHI. And when we consider that they're about to oversee the transition of services from Crumlin and Temple Street to the new hospital site, I think government has to intervene and put in a team of people who are actually competent to do this. I have no confidence in them. And I would appreciate if you could communicate the sheer import of this to your colleagues at Cabinet, because the question will be asked, when did you know? And when you did know, what did you do about it?
Thank you very much, Senator Clone. Just before I call on the Minister, I'd like to welcome Liam and Breathe O'Connor from Claheen in County Tipperary, who are here today as guests of our colleague Senator Gareth Ahern, and your guests. I hope you have a wonderful day here in Leinster House. What we're dealing with at the moment is commencements, where people raise issues of concern to them. And I have to say, my mother's in care, so I know Claheen very well. So I hope you have a wonderful day, and I've no doubt that Senator Hearn is looking after you. Now, Minister.
Thank you, and I want to thank Senator Clonan for raising this important issue. Senator Clonan knows there's probably no issue closer to my heart than the experience of children in hospital in Ireland, and I'm very glad to have the opportunity to provide the answer that I have been given by the Department to the Senator. But can I first say, in respect of the experience of the children, that children with additional needs, whether they be medical, whether they be personal, whether they be intellectual, whatever the additional needs are, it does make growing up so much more difficult. And their dignity in that process, throughout the hospital process, is, to my mind, paramount. And if there are issues that can be resolved reasonably easily, and forgive me, I'm not a medical person and I don't know, but you would think of particular importance is the personal hygiene and the personal care that can be made better by surgical intervention. And so it is a particularly important issue, and I understand the mental health and developmental issues that are aligned to the surgical issues as much as anything else, and that's why it's so very, very important that you raise it. I am told by the department that CHI, Children's Health Ireland, has advised that there are 163 types of procedures carried out by their urology team in Crumlin, Temple Street and Tala. They have 3 full-time urology consultants working on the service, supported by a multidisciplinary team. The onboarding of the 3rd consultant has created additional capacity to allow consultants to attend all spina bifida, MDT clinics in Temple Street, and urological procedures are also carried out by general surgical teams. Now, in the past year, CHI has undertaken work to reduce the number of patients on the waiting list for, excuse me, I'm going to say hypospadias, forgive me if I've pronounced it incorrectly, surgery repairs. A significant number of both single and multi-stage procedures have been converted from inpatients admissions to daycare procedures, which makes a big difference. This change in patient care has allowed an increase in the number of those procedures happening throughout the system. And additionally, the HSE has approved recently a 4th urology consultant post, which will allow for the creation of a separate urology call rota from general surgery once the new Children's Hospital has opened. And can I say I agree with your sentiment in relation to cost. I think when you're the parent of a child in hospital for a very long period, you know exactly how important it is, and the care that will be provided to children around there will be incredibly important. On the waiting list piece, and I think it's really important to go through this because it's important to set on the record today so that we can compare it with the future. The National Treatment Purchase Fund waiting list figures for January 2024 show that there are 1,135 patients on the outpatient urology waiting list in CHI. Of those, 55% are waiting 6 months or less, and 87% are waiting 12 months or less. I am told the waiting list has decreased by 6% when compared to the same period last year. In terms of inpatient and day case procedures, the January 2024 figures show that there are 476 patients waiting for a urology procedure at CHI. Of those, 40% are waiting 6 months or less, and 74% are waiting 12 months or less. The inpatient and day case waiting list has increased by 23% when compared with the same period last year, and there has been a decrease of 5% so far this year. I'm not sure how that, forgive me, I'm not sure exactly how that works. The figures also show a decrease of 5% since December 2023 in the numbers waiting outside the 12-week target. Now, I am told that the Minister accepts that the acute hospital waiting lists are too long and that many patients are waiting an unacceptably long time. He is aware of the impact that can have on children and families, so he has adopted a multi-annual approach through a series of waiting list action plans. And those 2023 plans build on the foundational work in previous plans, and we are seeing significant reductions in some waiting lists, but not all waiting lists. But in some waiting lists, very considerable improvements, and I can see that from working in my own constituency. There are some waiting lists that have very considerably improved. The overall waiting list reduction was achieved in 2023 despite 8% more patients being added to our waiting lists than was projected last year. But there's obviously significant additional work to be done in 2024, and perhaps the Senator has more details that I can pass to the Minister.
Thank you very much, Minister. Senator Clonan.
Thank you very much, Minister, and I appreciate the sincerity of your answer, and I know that you and I are on the same page when it comes to our concern with children and citizens with additional needs. Look, I have deep concerns about the surgical qualifications that some of these people carrying out urological procedures have. Many of them are general paediatric surgeons with no specialisation in urology, which would not be consistent with international best practice. Some of them are not on the urological surgery register, and really we shouldn't have surgeons intervening in that way. Look, we are in breach at the moment, on the watch of Children's Health Ireland, of the Article 25 of the UN Convention on the Rights of Persons with Disabilities, in that disabled citizens have a right to enjoy good health and development and so on. I have written to the chair of the Joint Oireachtas Committee on Disability Matters, and I want Bernard Gloucester, the CEO of the HSE, I want the Chief Clinical Officer, Colm Henry, and I want the CEO of CHI to come in and explain themselves, because this isn't one list, it's another list. You know, it is evidence of a lack of proper governance, oversight and management. And I think at this very, very sensitive moment, when we're transferring all the care, closing down 2 hospitals and going into a new environment, there is a serious risk that children will suffer needlessly life-limiting and life-altering outcomes that are avoidable, but we need a different management team in place.
Thanks, Senator Clonard. Minister.
Perhaps I won't comment on the capacity of the surgeons or indeed the current management team, but I will say that from my experience, the longer I am a public representative and engaged in the hospital system, I do know the value of management processes in delivering for patients, whether it's the reduction of some waiting lists, whether it's the fact that some hospitals don't seem to have difficulties with the A&E and the others have very considerable difficulties. There are different, management processes in healthcare management is extremely important. And certainly, I speak to constituents, if you're the parent of a child with multiple different multidisciplinary teams as a necessity, the management of all of that is extremely difficult for parents, and it is something that could easily be adopted by hospital managed, to think about things always from the patient's perspective and the patient's experience rather than the convenience of the hospital. And this is a mindset shift that could, I believe, be made not just by hospitals in Ireland but adopted by the state more broadly, to really think about things from the perspective of the patient and the convenience and the difficulty that they go through, and how appointments are scheduled. Particularly, I've always thought about parents coming with children from very long distances and the inconvenience of having an appointment on a Tuesday and a Thursday when perhaps those things could so easily be brought together. These are management questions, and you're right to highlight management issues. We can always do better in this, and certainly the management of the waiting list is something we'll be paying particular regard to.
Thank you very much, Minister, and thank you, Senator Clonard, for your constant advocacy on these extremely important issues. Thank you. Just